6 News is here for your health. Millions of Americans are struggling with debilitating fatigue, respiratory issues, as well as heart, neurological, and digestive symptoms after battling COVID-19. But now new research suggests that taking some simple, healthy steps could prevent symptoms of long COVID. Here's Dr. Malika Marshall.
Why do some people suffer long COVID symptoms and others don't? New research in JAMA Internal Medicine looks at 6 lifestyle factors: diet, exercise, not smoking, healthy weight, adequate sleep, and moderate alcohol consumption. Women who have 5 or 6 of these healthy building blocks are about half as likely to get long COVID compared to women who have 1 or 2.
What if Americans all had 5 or 6 of these healthy lifestyles instead of whatever they do have now? And we calculated that about 36% of long COVID cases would have been avoided.
The study looks at data on more than 32,000 female nurses at the start of the pandemic and follows them for a year. Dr. Andrea Roberts with Harvard T.H. Chan School of Public Health says inflammation may play a critical role.
There have been a bunch of studies to suggest that people who have inflammation in their bodies are more likely to end up with long COVID. And we know that a lot of these healthy lifestyle factors are related to reducing inflammation in your body.
Having a healthy weight and getting 7 to 9 hours of sleep a night are the strongest lifestyle factors associated with lower long COVID risk.
I think sleep is something we really overlook oftentimes when we're talking about health. And we all know that, our sleep habits maybe aren't the best.
Taking some simple, healthy steps could possibly prevent what for many is a long haul after COVID. Dr. Malika Marshall, CBS News, Boston.
Coming up on 6 News at 5:30 with